As we talk about healthcare, we hear about the increase in cost, lack of healthcare, lack of access, those types of things. What do you see as kind of issues with healthcare in your community? The good, the bad, and what could be done about it?
If I knew the answers on healthcare, I wouldn't be the mayor of Colorado Springs, okay? But here's my observations about it. Every place you look in our economy, markets are working and making products ultimately more affordable and things like that. For some reason, there doesn't appear to be functional markets in healthcare. I can't fully explain that. But I just had, I went to the doctor not too long ago. I was going to have some treatments for some skin cancer. I asked them how much it was going to cost. They had no clue. All they were willing to tell me is that your Medicare and your supplemental will pay for it. And they basically acknowledged to you, I don't know how much it's going to cost. Nobody knows until that final negotiation with the insurance company and how much they get and all that sort of thing. I don't see any equivalent to that any place else around us.
We would like to do that in the legal industry, but I don't think it'll work.
What I do know in Colorado Springs, we've got great health care. We've got two marvelous hospital systems that do in fact compete. UC Health and Penrose St. Francis building incredible expansion, got a new children's hospital. We're just thrilled with that. So there's no question my constituents feel very well cared for, lots of opportunities, but there's something going on in healthcare that market forces just aren't working in terms of, but I'll be the first to tell you when somebody says, oh, if we just throw in a public option, then we'll have that competitive deal. Well, you know for a fact, if the government puts in a government option, they're going to control the price. It's not going to be true competition. They're going to force Medicaid or Medicare rates, and it won't be a true marketplace. So I'm sorry I don't know the answer to your question, but the fact of the matter is it's all kind of a undiscoverable mystery that I'm listening to all the debates, presidential candidates, they don't know the answer either. So.
Okay. What about in Lone Tree?
So Lone Tree actually has Skyridge Medical Center, UC Health, and Kaiser. And I think, so those, and it's a very large segment of our employment is around healthcare. And in my conversations with the executives within those organizations, they are very concerned about anything about the public option. And I don't want to quote prices, but let's just say it's in the range of, they get paid 70 to 80 cents on a dollar service provided. So they're losing money already when they are forced to take, but not forced, I mean, but it is not they are not meeting their own costs. And how long can you all have businesses. How long are you in business if you can't meet your costs? If you're spending more than you're taking in, it does not work. So I too, like Mayor Suthers, don't have the answer. What I do believe in is the market, and I think a market-based approach to this is I think, the only real long-term answer to resolve this. And I think it, again, is one of those issues that will take bipartisan support and acknowledgement on both sides of the aisle that there's something to give. Most of us are kind of moderate on some of these things. We're extreme potentially on certain issues, but we're moderate. Everybody wants to know they can go and get good health care in the United States of America. It's something that we all should have access to. And when we don't, we're frustrated. I'm frustrated by it, but I do believe the answer is within the market, not with government telling the market what to do.
Okay.
I think, that's all right. There you go. I think this panel's at a bit disadvantaged because of our lack of real interaction, but we certainly see the impacts. And I think we all agree that if there, God forbid, I had a medical emergency, there's no place I'd rather be than the United States of America. It's the best healthcare system in the world. And here in Colorado, and certainly here in the Metro Denver area, In Denver, as mayor, we have access to, of course, the best public-owned or public hospital in the country in Denver Health. But we also have a great private and semi-private system, or access to private hospitals as well as semi-private hospitals with UC Health and the Anschutz campus. So we're very fortunate in this area with the quality of services. The issue is not the quality, it's access. And obviously, as Mayor Suthers and Mayor Millet have pointed out, even the presidential candidates are not in agreement on how we do this. I got to tell you that if there's an area where, as Americans, we ought to be most disappointed in, is that in the greatest nation on earth, we have a system that divides the haves and the have-nots. And unfortunately, we have people who can come down with the same disease or same medical challenge, but yet, if you don't have the right insurance, you may not access the quality services that's at your fingertips. And if you do, obviously you have full access to what you need and the very best doctors. And it's unfortunate that we create this bifurcated system or access to bifurcated access to our quality system. And that's the one thing I regret. I'm a moderate as well, Jackie. And I'll tell you that this is the one area where I stop and go, we as a nation, as a society, we got to find a way to do better, to give people access to quality care. Personally, one of the last things that my dying brother said to me on his deathbed is that this disease, I should not be dying from it. There is medicine in the system to help me live with this disease, but yet I'm dying because I cannot afford access to that medicine. That is a problem in the United States of America, and it's happening every day across this country. And that's what I'm alluding to in terms of the haves and have-nots and how, unfortunately, we're allowing the system to overwhelm and make decisions on who lives and who doesn't.
Western Colorado, for people that don't know this, in the valley where I live, we have about 170,000 residents, and the city of Grand Junction itself is 70,000. But we face a problem in more rural settings that we certainly don't have the competition forces, not only at a hospital level, but even down to the physician level. We can only afford X number of specialists in a community of that nature, so it can be difficult to get our costs down. I agree with the discussion about accessibility, but one of my biggest concerns about healthcare, and this is where my business as a CEO for as long as I was pops in, we don't have enough time being spent on the forces of cost and cost containment. We keep coming up with solutions that are pricing related, but not cost related. And I'll just give you one quick story. Dr. Brian Davidson was the CEO of St. Mary's Hospital, which is part of the SCL organization, which has many hospitals. And he and I got to be friends while he was in Grand Junction, and unfortunately, he's come back to the Front Range. Brian and I talked about it from the standpoint of just give you one item that we talked about a great deal. His concern was we have silos of excellence, and I think you've all heard that term, and we use it in business quite often. But he said in the healthcare business, he views one of the most significant cost problems is the fact of silos of excellence. That, in fact, physicians that are fully versed to do more with a particular patient are so concerned about being sued, they hand off to one another on a continual basis. And as they hand off to a continual basis, guess what's happening to the patient's bill? And one of the things, and I think his successor is going after the same thing, is how do we get back to our physicians and remind them they are medical doctors in addition to being specialists. And they can go outside of their area of specialty, and they should on basic types of things so as they're not driving the cost up by having all sorts of specialists that may not be needed for a particular patient. That's just one example, but I just don't hear enough being said by our federal and our state government about how do we get to the core problem, which is costs. We just keep going after price, and that doesn't solve the problem, with all due respect.
Okay, thank you.
I, for one, thinks there's some perversion in the system, and an example would be how many emergency centers are popping up around your communities, and you go there for a blood test and others, and that gets back to the costs of what's it really taking, and I think about that. I think we have a great medical care system for acute care, but we don't have a health care system, and that gets to the systems perspective and away from the silos of excellence. You know, at the end of the day, if there was more personal responsibility put on our health care, and we had a system that could actually support that, and that's where I think there's been some perversions built into the system that really isn't about health. It's really around acute care. If something's broken, or you've got something that's an accident or something where you need life-saving care, we have great systems. But, you know, and just in terms of every day, most of us, all the time, you know, I think we really need to rethink how we have a health system.